So most people living with chronic back pain stay stuck because they're focusing on completely the wrong thing. And I'll tell you what I mean by this. They're focusing on what's done to them rather than what they are doing. So what's done to them is scans, injections, medications, adjustments if they go into a chiropractor or a physio with hands-on treatments, massage, cupping, taping, needling, whatever it is. Anything that's done to them by someone or something else. But that's keeping them stuck because they think that they need to do this thing in order to get back to living their life. But what they need to do instead to free themselves is concentrate on their life in order to grow that. So improving their sleep, improving their diet, improving the amount that they're moving, reducing their stress, doing all these things that's just involved in their day-to-day life is going to be the thing that's way more likely to free them from pain than these sort of transient, short-term treatments that only really last for a few hours or the day that it happens on. And I've seen this in thousands of patients. So I have a lot of experience in treating people who are stuck in this cycle. And it's not their fault. They think that because they've been told that they're fragile, they think that they need to go to someone and be fixed. Because unfortunately, we live in this system where people are overly reliant on someone else to fix them rather than helping themselves out. And these things are often not actually that complicated. It's just applying the basic fundamentals over and over again consistently for as long as you need to until a problem like this goes away. Because back pain isn't usually just a back problem, it's a life and lifestyle problem. So it's probably not just the disc in your back that's gone and that's causing all your troubles. It's like, are you getting 5 hours of sleep? Are you eating terribly? Do you barely move? Are you stressed out of your mind? And you think it's just this disc in your back that's causing your pain? Well, I think we need to sort of zoom out a bit and take a look at the wider picture. Because if that's what you believe and what you've been told, then it's not a very helpful belief. And it's probably not going to get you back to a situation where you have a lot more capacity and you have a lot more control over your life in a way that you can just move freely and feel rested and not feel stressed. I think we need to work on these other things first, and then that will get the pain to calm down. So when it comes to short-term treatments like getting your back cracked, getting a massage, having dry needling or acupuncture done, having injections even, painkillers, anything like that, I'm not against it at all. As a physio, it's a lot of what we do. But if people become overly reliant on it and they're told by a clinician that they have to have, you've got to come back 3 times a week for the next 10 weeks, then that just takes away their agency completely. But we need to build people up and increase their capacity and their confidence in themselves. And that's what I'm trying to do. I want to say to people, you're okay to go for that walk. You can go and play that sport. Maybe we have to make some adjustments while you're in this situation, but why not improve your confidence and improve your capacity for getting back to normal life? That's what's going to improve you. Keeping you coddled up and wrapped in cotton wool isn't going to make you any stronger or more resilient or more better at dealing with pain. So why are we keeping you stuck there by telling you that you have to rely on these passive treatments? And a lot of time, a clinician may not even ask you about your stress levels, how your sleep is, even how much you're moving on a day-to-day basis. And these things are so important. They're just the basic fundamentals of health and wellness. And that massively affects pain, way more than your posture, your core strength, or any of that other nonsense that's been massively debunked. So a cycle I've seen with patients that have come to me with back pain time and time again, whether it's acute, like they've had it for a few weeks, or more chronic, they've had it for months and sometimes even years, is that they've reduced and shrunk their life to fit around their back pain. And I think what we should do, the clinician and the patient should work together to grow their life back. I think that should be the journey of them getting rid of their back pain. Not, okay, well, you've shrunk your life. Well, I'm going to do this to your back for half an hour and then you're going to go and come back again next week. It's nonsense. Maybe it'll have some transient effects that someone will feel a bit nicer that day, but that's about it, generally speaking. But I think building back your life, let's get you a better sleep routine. Okay, what can we do to get you a better sleep routine? Can we stop you drinking coffee at a certain time? That might help. That might be a place to start. It's just basic things to start off. Can we get you to go for a walk at lunchtime instead of sit at your desk? Can we do these basic things to try and build your capacity and resilience and strength and all these things to try and build your life and build your tolerance to things? That'll be the thing that improves your confidence, reduces anxiety, reduces fear. And also, not just building your life, but along with getting rid of the anxiety, fear, building the confidence, get rid of all the useless beliefs that are keeping you stuck. Things like, oh, I know it's my posture. I've had so many people, hundreds of people say to me, oh, my posture is why my back hurts. And I always push back against them and I'll ask, how do you know that? They'll say, oh, because I'm hunched. I'm like, okay, but how do you know that that's causing your back pain? Because that's not well backed in research. We've got millions, billions probably data points now showing that posture and back pain are not well correlated at all. And sometimes it can sound like I'm giving a patient a hard time, but I really want them to have better beliefs so that they can actually begin to get out of pain rather than stay stuck. Because a lot of time people will tell themselves this story of, oh, I had this car accident 20 years ago, that's why I have back pain. Or I played this sport, or I work in this job, or whatever it is. And that thing is keeping them stuck. And they'll defend the story rather than trying to say, oh, maybe I should adopt a new story, a new beliefs. And those things can actually help me get better, help me improve, build my strength, my capacity, my confidence, make my life better. It's sometimes people are stuck in the sort of victimhood mindset. And that's why we often have to start small. What one little thing can we change this week? Can we do a daily walk? Can we, start doing some small exercises? Can we get you back to doing a hobby that you love? Because people will stop doing things, like I said about people shrinking their life. They'll stop doing something they love because of their pain. But it's like, do it despite the pain. Reasonably, sensibly. If you've got 3 or 4 out of 10 back pain, you can go and play badminton. That's not going to kill you. If you have a little flare up, it's like, is it worth it? That's what how you've got to think about it. It's like, is it worth me doing this and having a little bit of pain in the long run? Because it probably is. Because you're getting all these other benefits from doing something that you love, but you are getting a little negative as well. It's like you've got to decide what's worth it in the long run. Because if you don't do something, then in the end, you probably won't be able to do it. It's that rule of reversibility, or sort of use it or lose it. If you're not exercising, then your ability to exercise will get less and less. And then your tolerance to pain will become less and less, and your sensitivity increase, and you get stuck in this cycle. It's not just the negative things, it's the positive things too. So it's like you have these negative beliefs, and then that stops you doing something you love. And then you think you're weaker, and then it stresses you out, and then you get worse sleep. And it's like all these different areas of your life get affected. And that's where, someone helpful, hopefully maybe like me, could come in and go, okay, you're clearly stuck in this cycle. Let's do something small to try and break it and start a new sort of positive cycle and a positive feedback loop that's going to go, okay, well, maybe we improve your sleep a bit. And that makes you feel less stressed. And then, maybe that means you're happier at work and you have a better relationship and you have less arguments with your wife. Whatever it is, right? It doesn't really matter. It's just something that's going to work for you ultimately. Because I think it comes down to working on your health. And I don't just mean biological health. And I don't just mean mental health either. I mean, the two are not mutually exclusive at all. But it's about working on your life. What does a version of your life that's 10% better look like by your own standards? Does it mean you sleep an hour more? Does it mean you feel less stressed? Does it mean you exercise more? Does it mean you're at this social hobby once or twice a week? Whatever it is, those could be the things that cure your back pain, or at least bring it down from an 8 to a 4, right? It's not, oh, I need to fix my posture. Oh, I need to do this. I need to go and see this person once a week for the rest of my life. It's not that. It's about you building tolerance, strength, abilities, whatever it is, in order to be able to handle life better. I'll tell you a quick story. So I worked in a clinic a year or two ago, and I had a woman in her 60s come in, and she'd had pain for months, sort of upper back pain, neck pain, and it wasn't getting any worse, wasn't getting any better, but it was daily and pretty unrelenting. And it sort of started out of nowhere. She'd been and seen someone else, and they told her that her neck was the wrong shape, it was degenerating, x-rayed her, showed her the x-rays, scared her, and basically told her that she needed this very expensive treatment in order for it to improve, right? And I knew the clinic that had done this, had said this thing to her. And I knew obviously that it was nonsense. And they never once spoke to her about trying to build strength, mobility, agency, anything, capacity, reducing fear, reducing stress. Nothing like that was even mentioned. It was just, you have to come to us and we'll fix you. And then that's it. And then she came to me in such a state and was so worried that her neck was just going to keep degenerating and she was just falling apart as she was getting older. And the best and most effective treatment that I gave her was reassurance. It was the reassurance that this wasn't going to happen to her. Yes, she has some pain. Yes, clearly, she brought the X-ray report with her. She had some degeneration. I told her that's completely normal and expected for someone her age. It's nothing out of the blue. She won't need any kind of crazy surgeries. It's extremely unlikely. And as I sort of built her confidence that she could live a normal life and not live in fear and stress, that was the thing that got her back to normal life. I did give her some passive movements. I gave her some massage, moved her neck, did some spinal mobilizations and things like that with her. And that, in that acute stage where she was really worked up, it was quite helpful. But after that, that was it. Getting her moving again, getting her to believe that she was fine because she was fine, was the thing that got her back to her normal life. I think a lot of the time, just giving people permission to move normally, to relax, to, lower their stress, to not worry about the position of their head or the tilt of their pelvis, to not worry about these things, is often enough to at least get the ball rolling back to being pain-free or reducing it massively. And I think as clinicians, we don't see that enough with people. It's like, you've just got to tell people sometimes that they are going to be okay if they can relax. And then you've got to give them the reasons to relax, because just telling someone to relax isn't enough. Telling them to, don't stress isn't enough. You've got to back it with why they shouldn't be stressed and how they can really help themselves, right? But my ultimate point is, there is no magic techniques that someone else is going to do to you that's going to ultimately fix you. Unless, something is seriously wrong structurally in your spine and you need a surgery to sort it out, then, that can massively help. But even then, there's still so many other variables that are in effect there. So it's about building capacity, building confidence, building your strength, not just physically, reducing stress, improving sleep. Your whole lifestyle is the thing that's going to help you. And I've worked with so many people, and I want to keep doing it in a way that empowers people, because I think some people have this fear that, oh, if I get rid of my clients, my patients too quickly, I'm going to run out and then I'm going to be bankrupt. It's like, don't worry. There's over 500 million people in the world with back pain. I don't think we're going to run out, and it's only due to get worse because of people's sedentary behavior, mostly. But that if you actually want to do something about your pain and you're interested in this and you find it helpful, then I've got a free 9-day plan. I've put the link down in the description. You can start, you just get an email each day for 9 days, and it just gives you helpful beliefs, starts you off with some very low level movements and exercises, and it sort of guides you to make the decision of exactly how you want to go with it. Some people can find that useful. If you're interested in that, hit the link and you can start it today.